why your 5-year-old is not talking and what you can do. Hello, parent. If you're listening to this, chances are you're worried because your 5-year-old is not talking yet or is talking very little. First, let me say this clearly. You are not a bad parent and you are not alone. Let's talk about why a 5-year-old may not be talking. One common reason is delayed speech and language development. Some children develop language skills later than others, especially expressive language, meaning they understand but struggle to speak. Another reason could be autism spectrum disorder. Children with autism may have difficulty with communication, social interaction, eye contact, or responding to their name. Not all children with autism are the same, but speech delay is often one of the early signs. Another reason, which is number 3, is your child may also have hearing challenges. Even mild hearing loss can make it hard for a child to learn how to talk properly because they're not clearly hearing sounds and words. And also another one, in some cases, children struggle with oral motor difficulties. This means the muscles needed for speech, like the lips, tongue, and jaw, may not be coordinating well enough to produce clear words. Another important factor is limited interactions. So for the limited interactions, children learn to talk through connection, through play, conversation, singing, and being talked to consistently. Too much screen time and too little interactions can slow speech development. Now, here is the most important part. A 5-year-old who is not talking needs support, not waiting. Speech therapy can make a huge difference. With the right strategies, structure, and consistency, many children begin to communicate. First with sounds, gestures, words, and eventually sentences. At home, you can help by talking to your child during daily routines, playing simple turn-taking games, singing songs with actions. For example, a very simple song is "If you're happy and you know, clap your hands," and you just make your child interact. Let them clap. If you're happy and you know, shout hooray, and you let the child shout. And also reading picture books together and even dramatizing. Like now, let's say we're doing a book about animals in the jungle and we're talking about a lion and we can say, rah! And then the child gets very excited and now the child is looking at you and now you get to interact with the child and that will help the child to develop their skills in communication. Also, giving your child time to respond without pressure, like don't just pressure the child, give them time, like, do you want an apple or an orange? And you're holding the two fruits. And then you don't have to make the child answer very fast. You can even ask the question several times and don't get tired because in speech therapy, you must be very, very patient. And please remember this. Your child is not stubborn. Your child is not lazy. And your child is not refusing to talk. Communication is a skill, and skills can be taught. If you're concerned, seek a speech and language assessment as early as possible because early support changes lives. Your child has a voice. Sometimes they just need help finding it. Thank you so much for listening. And if this video has helped you, please subscribe or share it with another parent who is in need. And also you can reach out to through the comment to Bright Talk Therapy Hub, whereby we can also give you more tips and guide you on what to do and the actions to take. Thank you so much.